The way I think about them are tools at the beginning, tools in the middle, tools in the end, and then there's the special tools that you need to use every so often. The first one is just the plain old introduction, using your full name, coming in with authentic delight at seeing the patient.
Hi, I'm Dr. Chow. I'm taking over for Dr. Fortin, who is the doctor who is seeing you for the last couple of days in the hospital. So I'm the new hospital doctor following you for the next couple of days.
The second thing is to decrease the space between the patient and the provider. And one way of doing that is to go into the patient's space first.
I'm sorry to interrupt your reading.
I wasn't getting very far anyway. I was just trying to distract myself.
Oh, okay.
Yeah.
I heard that your leg has been getting better over the last couple of days. And
Yes, that's right.
I'm glad to hear about that. I'm wondering if there are other things other than your leg that you'd like to raise with me today.
That is to say,
Well,
I would go into the patient's room and I said, I'm sorry to interfere with your reading, for example. In the outpatient setting, it's how is it that you got here? So Ms. Walters, really nice to see you again.
Good to see you.
So your hospitalization, I'm sorry that you had to go into the hospital for that leg.
Yeah, it's all better.
Research shows that if you get all of the patient's concerns out of the very beginning, you're less likely to get a doorknob question at the very end, which is one of the things that really hassles providers, is they hate to hear that, oh, by the way, I've got chest pain at the very end of the interview.
Well, I'm glad you're here because I started having some uncomfortable feelings in my stomach a little while ago.
In your stomach.
Yeah.
So it sounds important that we talk about your stomach in a little bit.
Yes, I would like that.
Before we do that, other than your stomach, are there other topics that you'd like to raise with me today?
Well, last night I was thinking that maybe I could go home today, but now I'm not so sure.
Okay, so maybe the stomach symptoms affecting your discharge planning, that's a concern of yours?
That's right.
Okay. Other than the stomach and the discharge, are there other questions that you would like to, other topics that you'd like to bring up?
And then the final thing there in the very beginning is to set the agenda for the visit. And that is to say, so these are the things that you want to talk about. I want to talk about these things.
So it sounds like we'll need to talk more about the stomach and then how it's going to affect your discharge. I'd like to look at your leg in a little bit as well to see how that's progressing. And in the 10 or 15 minutes that I'll be in your room right now, I'm going to be doing a physical exam, asking you more questions, maybe talking about the lab tests that we talked about this morning, and then develop a plan for today. How does that sound to you?
So by doing the elicitation all up front, then that makes them more efficient, and that's a good thing.